Now let's go deeper using traditional Chinese medicine to read the eyes. Here's Dr. Malik Cotter to teach you.
When we look at the eye tells us so many different things about the body. The eye tells us a lot about the energy of the body, the energy of the mind, the spirit of the person, the emotional situation. So the eyes tell us a whole lot. The eyes, when we look at the eyes, we can look and see we have an upper and a lower lid. We have the white of the eye, which is called the sclera. We have the iris, which is the color. And we have that black dot in the center called the pupil. Now, when we look at the eyes, I mean, in the science of iridology, which I use, but I don't put a lot of credence into it. I've been reading eyes for a while, iridology-wise, and I'm just not 100% gung-ho on it. I do use it, but I don't put all my eggs in that basket. I'll say it that way. It's just one strand of the basket. But when we look at the eyes, the sclera, let's start on the whites of the eyes. The sclera is the white of the eye. It's actually comprised of capillaries tightly packed together with blood coursing through it, ruled by the liver. The liver channel, the liver meridian, passes into the eye orbits, and then the liver meridian ends at the top of the head at governing vessel point number 20. The liver has a lot to do with the eyes and sclera. So let's look at the white of the eye for a second. When there's heat on the entire sclera, the whole white eye, the whole white of the eye, is telling us there's a lung heat. This would be someone who's maybe in a fire and they have smoke inhalation, or someone who is at a campfire and the wind blew and they just got hit in the face with and they had to breathe that smoke in. The red is heat. So when you see red on the entire sclera, it's a lung heat. The general reddening over the pupil and the sclera, now we're bringing in the pupil also, which is the white of the eye. Now we're dealing with a liver heat. And this you can see not only with a liver heat, but with a liver that gets laxed. By that I mean you can see people who maybe have a little bit too much alcohol and the whites of the eyes go bloodshot. It's because there's a stagnation happening. Now, stagnation creates heat. So the liver is in charge of the eyes. So when we have a general reddening over the pupil and the sclera, we're looking at a liver heat. How do we get rid of a liver heat? Well, that would be liver point number 2 would be a good point to take that heat out of the eye. And that's all the way down on the foot. But the eye is on the head. That's right, because you're going to use distal points and the foot is furthest away from the head. So we're going to use liver point number 2 to take the heat out of the liver. You may also want to use a gallbladder point. Gallbladder point, Guanming, I'm not sure what the number is offhand. I think it's 6 body inches above the exterior ankle, the exterior malleolus, come up 6 inches from there. That's a gallbladder point, and Guanming, it means bright eyes. That's what the name means. So that point would also be indicative to use for an eye situation. Red eyes, red lines in the eye, also break down into blood congestion. So it's telling us where it's congested. If you take the eye and you break it into 3 equal parts, the upper part of the eye will be the upper burning space. The middle part of the eye and the pupil will be the middle burning space, and the lower part of the iris and the sclera will be the lower burning space. That's telling you where the line, the red bloodshot eye is. It's telling you what part of the body the blood stagnation or congestion is. So the eye is telling you what's going on by looking inside, and that's the white of the eye. If there's red dots on the eye, now we have a little bit more blood congestion, blood stagnation. You've probably seen this, I've seen this on patients of mine, little red dots, not only on the white of the eye, but also on the body. When you see these little red dots on your body, it's telling you blood stagnation or the blood congestion. And it's telling you in that part of the body. On the meridian, on the channel line, it's telling you that meridian, that channel, which has an organ response, has got some blood stagnation. So we pay attention to these little red dots, not only in the eye, but on the body, and even more so on what channel these may be on. Green dots, when you see green dots on the white of the eye, what we're basically looking is the cells are breaking down. We're having a cellular disintegration is what's going on. Now that's good, as long as there's new cells being regenerated that are stronger and healthier to take its place. If not, which green dots usually represent that we're having a cell breakdown and they're not reproducing as quickly as they're breaking down. Green dots on the white of the eye. White dots. Now you may seem like, how do I see a white dot on a white background? You'll see it because it will be a little bit more on the opaque side, a little bit more on the yellowish side, this white. And that represents, when you see this yellow-white dot on the white of the eye, it's telling us that there we have a fat mucus accumulation. Usually it's indicative of cholesterol, where the cholesterol, the LDL, the low-density lipid protein, is elevated. So we need to look at the whites of the eyes also. A bluish tinge over the whole eye gives us a nervous system imbalance. The nervous system is not properly being nourished, and it's being overutilized, or maybe it's being frayed, or maybe someone is doing too much drugs and alcohol and sugar and rock and roll. I'm not sure, but I'm just saying that a bluish tinge is going to be a nervous system imbalance. Brown dots on the white of the eye, hardening of the arteries. Red dots near the nose, or red around this area here in the eye and the nose area, that's the heart. The heart fire is rising. It's coming out and it's showing itself in the skin around the area of the eye and the nose. A sty is going to be a damp heat congestion. That means that your body internally, your digestive system is too damp and it's too hot, and that's what creates a sty. That's one reason. The other reason could be something from the exterior. The exogenous pathogenic factor may be coming in with the wind or dust or sea mist or salt water or some chemical in the air. That will also create a sty because the pores will get congested and blocked. So when we look at a sty, we look at anything in the body actually. Let's look at it this way. See where it is. It could be the problem in the local area coming from an outside source, and it may be coming from the internal organs coming from an inside lifestyle problem or something has gone wrong. So a sty is a damp heat, and we basically need to treat the gut, and we need to pay attention to the eye itself. If the lower lid of the eye becomes puffy or swollen, it's a kidney deficiency. It's a kidney energy. It's a kidney yang energy, metabolism, fire deficiency. So the heat is not going to allow the water to evaporate, so it becomes puffy and swollen under the eye. So lower lid, puffy, swollen eyes are going to be a kidney qi and a kidney yang deficiency. The swollen upper lids, when the upper lid of the eye becomes swollen, it's no longer a kidney, it's a pancreatic digestive dampness. So if we have swelling above the eyes, above in the eyelid and the eyelid itself, that's a digestive disorder where there's too much dampness. Swollen upper eyelids, spleen, pancreas, digestive dampness. When the eye orbit, the eye it sinks, when the eye sinks into the head, like someone who may not have eaten in a while or someone who's under a lot of stress, when the eyes are sunken in, basically that's telling us there's a body fluid depletion and the yin and the yang of the body are in deficiency. In other words, the nutrition, the energy, the blood, it's just not there. So the eyes will sink into the orbits. If there's fatty tissue on the eye, now this may be called a tritium, where here in Hawaii it happens often because of the sea mist. A tritium is basically to where the eye is creating a film to filter and protect itself. this tritium on the eye, it's wind heat, basically, and it affects the heart and the lungs. So what we're looking at with this tritium, or this fatty tissue on the eye, look for wind heat in the upper burner, or possibly a damp heat in the middle burner digestion. It could be something affecting here. If it's dry, that's going to be wind and heat. And if it's going to be more moist, that's going to be damp heat. How can you tell a damp heat from a wind heat? Well, let's just look at the skin for a second. If it's dry and hot, that's wind heat, because wind dries and so does heat, and it's red, so there's the heating aspect. If it's going to be itchy, that's wind. Wind is lack of blood because it dries it out, which creates an itch. The damp heat is seen by something that's going to be swollen and red, but it oozes. There's an ooze coming out. There's something that's coming out, a fluid of some sort. That's the dampness. So the difference between a wind heat and a damp heat is the dampness, or the fluid itself coming out of the damp heat, which you relate to then your digestion. As a wind heat, you relate to more of the heart, respiratory, and circulation. If the pupils, now the pupil of the light inside the center of the eye is light sensitive. So if you pull the flashlight in towards the pupil, it should constrict. If you move it away, it should dilate. If it doesn't do that, we got a nervous system problem. I know that when you look at someone who's been in a trauma or in shock, that pupil will not dilate. It will just stay contracted because the nervous system is being involved. So this is also can be from drugs, from different, not only recreational, or I didn't want to call them recreational, for those poison drugs that they do, and also the drugs that you get from your doctor. Some of them aren't good. Oxycontin, I'm just thinking of the opioid situation going on. That will also create the failing of the pupil to contract when light comes upon it. If there's a fixed stare and someone is just locked in and fixed on this gaze and they're not moving, that's usually where the wind in the liver has got not enough blood. Lack of blood creates wind. To get rid of wind, and now what's a sign of wind? How about a tremor or a twitch, shakes? These are all wind imbalances. Dizziness is a wind imbalance, it's too much. So what causes the wind imbalance is lack of blood. How do you get rid of a wind imbalance, the tremors, the shakes, the dizziness? Build the blood, because that's where the deficiency lies. So if we have a fixed stare, then it's going to be a liver wind involvement where the liver needs more blood nourishment, and there's lack of movement of the eye. Well, that's because the fixed stare, lack of movement, that's a Qi deficiency. So when we look at the eyes, we can get a real good understanding of what's happening with the internal organs also. So when you're with your clients, look at their eyes. Be genuine. Be honest. You can tell them, I'm looking into your eyes because I want to see how things are going with you. In days of old, physicians had the art of assessment and diagnosis and evaluation so fine-tuned in, so dialed in. And what they would do is they could look at the eyes, the complexion, the tongue, and feel the pulse, and they knew where they were going. Now that's a high degree of someone who can evaluate and assess. Our job, we're learning. We're learning how to do this. We're beginning to understand. So the more we can understand, the greater we can help someone. So look at the eyes. See what's going on with them. Look for the abnormalities. The eye should be bright. It should have glitter. It should be clear. It shouldn't be foggy and blood congested and dull. So look for this bright, clear eyes.